Hi, I'm Sandy Kurtin. We're here today to talk about living with low blood counts. So what can I do if I have low blood counts? Well, low blood counts, or cytopenias, are common in patients with MDS. The symptoms associated with cytopenias are often what prompt a visit to the doctor. The low blood counts, or cytopenias, result from the inability of the bone marrow to produce mature and functional blood cells. The myeloid cells are the most affected in MDS, and these include red blood cells, white blood cells, in particular neutrophils, and platelets. The red blood cells carry oxygen to all the tissues in the body. White blood cells fight infection, and platelets help to clot the blood and prevent bleeding. One or more of these myeloid cells may be affected by MDS, resulting in cytopenias. You can learn more about the bone marrow and what happens to the bone marrow and blood cells by exploring the building blocks of hope. The most common cytopenia in MDS is anemia. When you're anemic, you may experience more fatigue, shortness of breath, especially during exercise, an irregular or rapid heartbeat, headaches, and in more severe cases, chest pain, mental confusion, or difficulty concentrating. You may also have lightheadedness when standing. Red blood cell transfusions are a common way to provide temporary relief of these symptoms of anemia that are associated with MDS. Nearly 90% of patients with MDS are treated with red blood cell transfusions at some point during their diagnosis. Transfusion dependence, or the need to receive repeated red blood cell transfusions due to MDS, is often a trigger to initiate disease-modifying treatment. The number and frequency of red blood cell transfusions will vary for each patient. The decision to transfuse red blood cells will be based on your symptoms as well as your blood counts. The process for obtaining matched red blood cells and infusing them may require more than one day. There are some potential risks associated with red blood cell transfusions, such as allergic reactions, viral infections, fluid overload, and iron overload. Most side effects are mild and easily managed with medications. More serious reactions can happen but are rare. There are things you can do if you are anemic. Record and track your blood counts, blood type, any antibodies, transfusion dates, and any symptoms you experience before or after your transfusions or growth factor administration. There are tools included in Chapter 5 of the Building Blocks of Hope booklet that will help you track your progress. Let your doctor know if you experience increasing shortness of breath, chest pain, or palpitations. Keep all of your appointments as scheduled, and if you're feeling too tired to go to your appointment, it may be an indication that you need a transfusion or other treatment. Ask for help from a family member or friend so you can keep your appointment and see why you're feeling more fatigued. Balance rest with activity. Some patients with lower risk MDS may benefit from the administration of erythropoietin-stimulating proteins, otherwise known as ESAs. There are regulatory guidelines for their use. You can learn more about ESAs in Chapter 2 of the Building Blocks of Hope, called Seeking Treatment. Next, we'll talk about neutropenia. Neutropenia is a decrease in the number of neutrophils. Neutrophils are a type of white blood cell, or WBC, that help to fight common infections. When the neutrophils, or the WBCs, are low, you may be at an increased risk of infection. Neutropenia is less common in patients with MDS than is anemia at the time of diagnosis. In patients receiving disease-modifying treatments for MDS, the white blood cell count, and in turn the absolute neutrophil count, or ANC, are commonly reduced in the early months of treatment. You can learn more about calculating your ANC and managing neutropenia by exploring the Building Blocks of Hope quick tips and slide series. The most important things to know is when you need to seek medical attention and how best to prevent infections. Let your doctor know if you develop a fever. This is most important if your ANC is less than 1,000. And if you are not sure what your ANC is, ask your healthcare team for guidelines on when you should report a fever. Keep all your appointments as scheduled. Have a working thermometer at home, something very practical. Record and track your blood counts, including the WBC and ANC. This will give you an idea of your trends. Any symptoms, including fevers, chills, or infections. You may receive white blood cell growth factors to reduce the severity or duration of the neutropenia. And although the administration of antibiotics for prevention is not commonly recommended for most patients, some may be recommended for patients at greater risk. If your neutropenia is severe, it may be necessary to modify your MDS treatment by changing the dose or holding the medication temporarily until the neutrophil count recovers. One of the most important things you can do is to wash your hands frequently. This is the single most important way to reduce the risk of infection. Other strategies to reduce the risk of infection include avoiding people who are obviously ill, avoiding crowded enclosed places, and following certain guidelines for foods and eating out. These are covered in more detail in the Building Blocks of Hope section on staying well. Lastly, we'll talk about thrombocytopenia or low platelets. This is the least common cytopenia for patients with MDS. It may be present at the time of diagnosis or develop in the early months of treatment. The greatest concern for patients with thrombocytopenia is bleeding. Some of the symptoms you may experience when your platelet count is low include excessive bruising with normal daily activities, bleeding gums, a bloody nose, cuts that won't stop bleeding, and petechiae, which are pinpoint red dots, often on the chest or the legs or other parts of the body. The most common way to treat a low platelet count is a platelet transfusion. The benefits are temporary, and the level of thrombocytopenia, which requires a transfusion, may vary for each patient. You should talk with your healthcare team about thrombocytopenia, what symptoms need to be reported promptly, and what you can do to reduce the risk of bleeding. Cytopenias are the most common side effect of disease-modifying agents used to treat MDS. They are expected when treatment is started, so that your blood counts may actually drop lower before they begin to improve with treatment. I call these expected cytopenias. Many patients with MDS may never recover their blood counts to normal levels, but may have levels that are sufficient to avoid any serious side effects, what I call moderate asymptomatic cytopenias, and the new normal. Keeping track of your symptoms, tracking your counts, and learning ways to stay well will help you live well even with cytopenias.